right. Well, welcome everyone to our session today, Mind the Gap. So this session is really focused on data is everywhere, and we all need to be data people, both technical and non-technical people. And there's a gap between those who understand data and those who don't. Is this a problem? How do we embed data culture and communicate that to non-technical people and what their roles in that culture are? So here to discuss this important topic is our esteemed panel that I'm privileged to moderate today. We have Eric Sutherland, Executive Director at the Public Health Agency of Canada, leading work on the Pan-Canadian Health Data Strategy. Brigitte Bauer, Digital Health and Social Media Expert, Patient Expert, and for Manufacture for Antworten, UG, and I hope I pronounced that correctly.
Yes, of course.
And then our third finalist is Dr. Charles Alessi. He serves as the Chief Clinical Officer for the Health Information Management Science Society, or HIMSS, as those of you in the health sector working in this space are probably familiar with. So, given we have a short time together today, we'll get right into the questions. And if you want to offer a bit of context to your responses, feel free to do that. And with the first question, we'll start going with Brigitte answering. So in your experience, why is it important for health stakeholders, both technical and non-technical, to understand data?
I would say to understand data means also to understand the world of patient advocates, the world of diseases, and the world of healthcare better. It's not just about data, it's also about information, and we have to know more about the people, the diseases, research, and whatever. So it's the whole sector, and it's not just patients, it's for everyone to understand the data, because that means also to understand more about digital health.
Absolutely. And actually, that's a theme that we've seen through the day. So to you, Eric, what would your perspective working with the Public Health Agency?
Well, and more specifically, my job, as much as I work at the Public Health Agency of Canada, is more broad than that, because data is increasingly required to answer any number of public health questions, health systems questions, research questions, and I would argue, most importantly, the questions that the public and patients have in order to improve and be empowered in their own care. And so the reason why it's important to understand data is so that ideally individuals can be more empowered and communities can be more empowered to improve their own health outcomes in the way that they would achieve those outcomes themselves. There is a second layer of it. It's not just the data literacy, it's also the appreciation for data governance within the health ecosystem or health sector in and of itself. Because data flows across organizations. No one organization delivers care. And so how do those organizations orchestrate their activities in order to enable an individual to achieve their personal health outcomes informed by all the data they have, all the insights they have, all the information they have from leading research, from monitoring safety issues, et cetera. So all of that needs to come together, and all of that rests on the back of data.
Yeah, absolutely. And actually, Charles, from the work that you've had the opportunity to do around the world, I'm sure you've seen a lot of this from your perspective with the work with HIMSS, and then actually as a clinician working in many health systems as well.
Well, I mean, talking about the world, yesterday I was in the Middle East, and the phrase there is data is the new oil. Mind you, they said this perhaps not quite appreciating that climate change summit is taking place. But in essence, I mean, you get the meaning, because I think the world has changed dramatically in this pandemic age. Certainly in the care of non-communicable disease, what we're thinking of is lifelong approaches to health and care, together with personalization. Now, how on earth can anybody even attempt to address this without data? In the care of communicable disease, in the management of a pandemic, how on earth could one manage to even attempt to do this in the absence of data. Until recently, I was senior advisor to Public Health England, and data was basically all we talked about. And also, we need to remember that data is the basis for all the innovations we're talking about, and we're hoping will help us towards personalizing care more, towards ensuring we activate people more, towards engaging people more in their own health and care. Without all of this, without data, there's nothing. But of course, it brings its problems as well, because problems around secondary use of data are very well known. Problems around consent and the nature of consent. Problems around governance. I mean, there's problems that come with that. But the problems are the problems we have to solve. The answer is not, let's ignore the data, because if we do that, basically, I just question what type of service we'll be offering our citizens.
Absolutely. And as you stated, COVID has really pushed the non-technical leaders to really engage in this space. And perhaps in alignment with your response, Eric, for the next question, especially around the governance, as you both highlighted as being really key. What do health leaders and stakeholders need to know about data in order to start affecting change in their organization and health systems, particularly in that context?
Well, what I observe, and I've heard this story repeated in many places, where we have built silos to solve our individual data problems consistently wherever we are. And then we built scaffolding in order to connect those silos together, where we have to answer new questions that are posed to us. And then we have to maintain the silo, and we have to maintain the scaffolding. And then to build new scaffolding when we have new questions, it takes a long time and it's hard to do. Or we have to build a new silo in and of itself. So that just sounds very onerous and painful. From a leadership perspective, I think it's in part recognizing that the old way of doing things, the analog way of doing things that we've done in the past, of building silos of paper, is not the appropriate approach to data in the digital age. If we actually want to improve care, we have to establish networks, and networks wherein the pockets of information we have are designed to be connectable and actively reused across the network of data in and of itself in order to achieve the outcomes. But work is required. New roles are required in order to do that stewardship, to connect those different groups together. Unfortunately, I've seen in many cases the new roles, the chief data officer, information officer, security officer, et cetera, often fall on the shoulder of providers. And they are neither, some may dispute this, but I'll say, they are neither qualified nor interested in doing many of those jobs. So we have to find ways of allowing the new roles of data to actually be stood up in new functions that are complementary to the legacy functions that must exist in a health system. And we have this nice little debate about data as a new soil going on.
I love it. I think it's far better than oil. Thank you, Emil, for actually bringing that up. Far better than oil.
Yeah, that was definitely something that pinged in my head too. I think we definitely need to reconsider how we're considering data as a resource, and that could actually actively change how we're viewing, how we're creating and deriving value. But
I was just going to add on to that in terms of analogies. Like, one of the problems that we have from a data perspective is that oftentimes people get distracted with the shiny objects of things like AI and digital and new technologies that are emerging, new capabilities that are emerging. And in many cases, many of those things rest on the shoulders of data. And so the analogy that I've started using is that if you want to do things like digital or AI without focusing on the data, what you're doing is you're building a car without wheels and without roads to connect your communities together. And so we need to really emphasize that the ability to connect things really is on this network of data in and of itself.
Yeah, absolutely. And I would actually, like, to your earlier comments, I think a big part of it with this non-technical part is almost some basic change management. And I think both Charles and Brigitte will have really interesting perspectives on that for affecting change, because really it's about engaging in a way that we're making the different stakeholders a part of the process. So from your perspective, Charles, I wonder how you would, your view of that and what the non-technical leaders need to know.
I mean, there are some technical issues to do with data, which I think we can't ignore. Everyone aspires to semantic interoperability, which is a little bit more than getting a wire between two data banks and connecting them. Because if one is measuring apples, the other one's measuring pears, you have apples and pears, not the addition of that. You can't compare them directly, of course, and that's obvious. But the change management, of course, is by far the more difficult. And I don't mean to belittle my technical colleagues, because, of course, there are significant hurdles to overcome technically in terms of getting data which is useful and clean data. But let's assume that that's doable, because actually it is. It's only a question of with how much effort is it doable. The bit where things are perhaps less doable is when they start dealing with people. And this all deals with people. Data has a terrible adjunct with it very often, whereby data is used to show people up for not delivering, to show what people are doing. And that has sort of remained with data. And it makes me terribly sad, because the moment you start talking to clinicians about data, some of them run out of the room in such haste, because they think that suddenly what they do is going to be exposed to everybody. Now, data does that. Of course it does that, but it doesn't need to do that in a way which is threatening. You can use these things constructively. And you also need to be thinking of data input and data usage as meaning something for the individuals who are actually working. Data in the clinical flow, for example, is something which is really important, rather than assuming that clinicians will spend their lives inputting data to be used for administrative, sometimes fiscal purposes, which isn't exactly why people have entered into the caring professions. So there's all sorts of issues around data, but governance is something which is basically a human interaction between people who agree with each other that there is a single way of doing things. Now, for some of them, perhaps it's the wrong way, because their way is usually better. But there is an element of compromise, negotiation, and actually working together. And some people find that easier than others.
Yeah, absolutely. And I having implemented electronic medical records, that was always something very surprising to me at the beginning of that journey, was the perspective of some of the concerns from the healthcare providers. But Brigitte, I think with both your experience in digital and then with patient advocacy, I think, those are two very specific areas in which your perspective of what the two groups need to know, and then how do we bridge that as well, would be great to hear.
That's funny, because I discussed that before I came into this room. I'm working in parallel today here from Berlin, from the Ministry of Health, for the Health Innovation Hub. They have a congress here. And we had exact the same question in my previous discussion, which was live here. I said, we have to educate the people. So we are talking about data. And at first, when we talk about data, we need to talk about the quality of data, because not every data set is what we need or what we should use. Sometimes data are misinterpreted, or sometimes data are not very clear or clean. And this is what we have to focus on. And on the other hand, we have to educate the people. And I said it before, as long as I have to educate and inform my GP about the use of data in digital health, there is something going wrong, because I'm the patient. And I should not have the job to explain him or her what's going on with digital health and data sharing and all the other things. So I think we need educational and informational programs for everyone. Means HCPs, pharmacists, politicians, citizens, patients, whatever. Everyone should have and should grow the awareness and the literacy when it comes to data, health data, and also digital health. And this is what I also miss here in Germany, because we have a lot of things in place also worldwide. And I can see that because last week I was in Helsinki. I saw a lot of things going on about the European health data space. But we have to answer the question, do we do the right things at the moment when it comes to give information to the citizens? And this is not happening at the moment. And I think we have to create more awareness for that, and also more informational programs, understandable, user-friendly, easy to find and easy to access.
Yes, and I have to acknowledge your comment in the chat as well. I enjoyed the lightsaber. And I actually, your closing remark there, finishing remark was great for sort of redirecting and shifting our mindset to the next question. And I'll lead off with you, Charles. Getting into sort of more, how can we change this, and how can we sort of move forward? What are some of the more innovative methods that you've seen around access and sharing in the health space? And even to what Birgit was just speaking to, actually all of you have spoken to, increasing that data literacy of these technical partners. So loaded question.
Well, it is and it isn't, Jennifer, because in many respects, if there's one thing which COVID has done, which isn't negative and terrible, it's that it's really advanced the digital revolution. It's really advanced the process of us accepting that digital modalities have become the mainstream. We got into serious difficulty at the beginning of the pandemic by ignoring people with non-communicable diseases, only because, of course, we're completely consumed by managing people with COVID, the communicable disease. The end product is we have this enormous backlog now to cope with. And we haven't even started yet because, of course, everyone's being diagnosed a little bit later. So we're going to reap that over the next 10 years. But what does that mean? What it means is we somehow have to manage this population in a different way. And the only way we can do this is digitally. And I think clinicians all over the world accept this. They don't necessarily like it, but they accept it. And they don't necessarily like it because sometimes the implementation of these processes are not done in a very clinician-friendly way. And by clinician, by the way, I mean nursing, pharmacy, whoever. And secondly, because we haven't assisted people to come to terms with these new modalities. Because what I see happening, and it's really quite frightening in some respects, is people just assume that things like telehealth, for example, I mean, people conflate telehealth with digital transformation, but let's ignore that for a second. People assume that all it is a translocation of a face-to-face meeting. It's nothing like it. We know that most of the insights we get about people are not in verbal communication, but actually happen on the periphery. Suddenly, you're dealing in two dimensions. So we're spending a lot of time on training courses, but training courses which don't tell you, oh, do you know if you're doing a telehealth consultation, you need to have a camera? Oh, you know you need to be in the light. Oh, and by the way, remember to wear a shirt and not a vest. I mean, of course those are important, but really assisting people in understanding how to consult, how to show compassion over a camera, how to ask a difficult question, how to turn the camera off sometimes, how to negotiate the difference between listening and hearing, transactional relationships and longitudinal relationships, all the stuff which we all know about around the interaction between people. And that's some work we have to do.
Yes, absolutely. And I think so much of the change management pieces that come out in that are really integral and have been missed in a lot of the analysis and when we're considering new solutions, right? So you automate any workflow, you accelerate and enhance any of the flaws in that workflow. And that largely is a big part of where we need to do some of that translation, and clinicians are key to that translation. So, but Birgit, I would be really interested to hear your perspective from shifting to this perspective of things, more innovative approaches. How can we look at that? What are some of the methods that you have seen in your practice and consultations?
Honestly, at the moment, I'm waiting for more innovation because it's too less. What I see, what helps to be more open to patients and citizens and explain things in digital health and also in data sharing much better is the initiative Data Saves Lives coming from the EPF and IHD, which is a very valuable tool. And I'm a member of the editorial board and also have done the toolkit pilot group, because we can see that a lot of people have a problem to communicate properly and understandable because it's relatively new. That's why I'm saying I need more innovation here. And I think people have to start now. And this is not a thing which is going maybe from 1 minute to the other. They have to change their mindsets. They have to start think in a complete new direction. And this is also not so easy for them. I can understand that. So we have to start projects like Data Saves Lives, or also portals for citizens to explain and to bring them on to the theme. And I think this can help also to make people more understanding and more open-minded to go to this innovative path and move forward with the innovations. But I can say that from the German perspective, we could do teleconsultations with our doctor since 2018, but nobody did it because it was not good communicated, and it was, I think, too late for that. Coming to Charles and wear a shirt and wear makeup or whatever to look proper when you see your doctor, which is not necessary, because when you see your doctor, you have a health issue, and this should be managed, not your clothes or your style. And in 2019, doctors thought, okay, we have COVID. Maybe we should especially look at the patient groups who have the big issue with the virus. When they go to be sick with corona, then they have a bigger problem. So we have to start to do teleconsultations. And so corona become like an accelerator. But now we have to take care for two things. We have to take care that we can bring the people in and think more, also to bring them to a more innovative thinking and understanding. And also we have to move forward with all that. So Corona is not over, but we have done some solutions and we have to move forward now. Don't stick in that situation or don't stop innovation. So move forward and make it a little bit better, because now we have I think it's a good opportunity to change things now, and we should use that.
Absolutely. Bert, did you want to just jump in?
Yeah, of course I do. I wholeheartedly agree. I was actually, I think we have to remind ourselves that the reason why we care about this is ultimately for the person, the patient at the end of the day. And we need to meaningfully listen to the public and patients and communities to understand what are your requirements for you to trust us, governments, public sector, private sector, with your health data in and of itself. And how do we demonstrate that trust? And then we need to embody that trustworthiness and then check with the people to see if we've actually earned the trust or not. And we need to go through that process. And I think too much what we've done is we started with technology solutions and said, look, we've got this fantastic thing, you should be using it. And many people, the public say, why are you giving me this? It's not actually what I want. And I don't know if I trust it. One patient said to me last week, if you don't trust me with my data, why should I trust you with my data? And that was, I think, a very telling statement of why it's so important to start the conversation with the public. It is so important to understand that. And building on what we were also saying here, we also, as part of that work, need to find ways to demonstrate the value of participating in this work with the public and with providers. Because too often we've implemented systems that from a care provider perspective, it's like a sponge. We'll just pull the data that you are providing to us about the patient, and we may or may not use it somewhere downstream where we're not ever going to expose you to anything useful about the data in order to provide better care. And no wonder that there's this broad problems of the workforce being burned out. So how do we actually use data in a way where it can actually circle back and improve care for the patient by giving greater insights to the provider and giving greater insights to the individual? And riffing off of what Phil said in the Q&A, I agree from the various conversations. We don't need to make the public or providers into deep statisticians, but we do need to help them trust the usage of their data within the ecosystem in of itself. We just see news stories about security breaches and privacy breaches everywhere, and no wonder the public doesn't trust others with the data. So how can we actually build systems where they can actually accept that there is value in sharing data that can actually be for their benefit and for the public good in of itself, that can actually be more important than keeping it private, which for my British friends sounds a lot like the Caldecott principles.
It's very entertaining. I saw a call out to the European Digital Principles response or consultation where it was, we don't need to understand how the engine of our cars work, but we do need to understand that they go through safety measures that we can, when we get in that car, it's something that we can ensure is safe. We know how to use it. We understand the things that we need as an operator, as a car. I thought that was an interesting analogy. But recognizing we're coming to our close and we have so many great questions and I would love to continue our discussion. I'll just close out with the one question at the top here. In your opinion, what is a data person? So, maybe a 30, 45-second response from each of you. And if someone has something burning, if you want to go first.
You choose somebody.
Oh, Charles, well.
Okay. Well, data used to be the province and used to be the world of a few selected people who were data scientists once, because they're the only people who sort of understood this nascent new science. Data is now everybody's business. Absolutely everybody who's involved in health and care has some, is driven by data. If they're not, they got a question as to, why they're doing what they're doing, because it's very similar to me taking my glasses off and pretending I can see what the hell's going on. I can barely see the screen. So I think this is the new data person is all of us, and it's about time we understood the power of data and also started to engage much more in managing that data, our own data as well, particularly things like secondary use. We've seen some pretty bad car crashes there. I hope we've learned how to drive a little bit better.
Absolutely. Eric.
Well, it's ironic that we're leaning into the car analogy because what I said earlier on, but if I actually extend that, when we drive on roads, there are rules that we drive on the left or right, as the case may be, that we understand how things are, we understand how to drive and how to operate all thousands of cars working together with shockingly few accidents that happen because we all understand and abide by the rules. And I think that there's a great analogy that we can use into this space to say, if we're clear about what the rules of engagement are, if we're clear about what the literal rules of the road are with respect to data for our data exchanges, we can actually all learn how to trust each other when we're working in a common space. And so I think that's one of the major things we have to do with all the ecosystem players that we're talking about.
Absolutely. And it's been a key theme today is talking about data governance. And then even, how do we get that leveled up to an international level so that we can engage as a global community? So to you, the last word, Brigitte.
I would say I'm a data person and we are all data persons because we generate data from our first minute of this lovely planet, means when we are born. And when we leave, unfortunately, we had, I would say, produced a lot of data. And I think that is something we have to keep in mind because we live with our data and give it to the next generation as we receive data from the other generation before us. And I think we learn from that data, but we have to be more conscious with it.
Absolutely. Well, a huge thank you to all of you. I greatly appreciate you joining us today. To the audience, for your questions, I apologize we didn't get to all of them, but hopefully we'll have an opportunity for more discussions in the future. So hope you enjoy the rest of the summit.
Bye. Thank you.
Thank you.
People are hanging around because we're so cool.
For Charles, for the HIMSS market maker, that was the data's the new oil. That was something that I put forward in reconsidering this analogy.
I agree. I love the new soil. I was just repeating what I heard in Dubai yesterday. They were all saying data's the new oil, and I was going, but of course it's the right place. You know, that's all. Their economy is based on oil and gas. But of course, it's the new soil. It's perfect, and it's reusable. Perfect.
Well, and if you relate it to the oil economy, though, you are not going to see a Saudi Arabia emerge in the data economy, because like it's a reusable resource. It's going to be the organizations or the countries that can figure out how can they cooperate and collaborate with others in the global data economy. Those are going to be the ones that are successful. Those are who are going to derive the most value from the data.
Don't underestimate the Middle East.
Yeah. No,
they deploy with such speed, and they deploy with such determination, and also some of their political systems manage dissent in a somewhat different way, shall we say.
So if we extend this analogy from an oil perspective, hoarding is what helps drive up the value of oil, whereas arguably sharing is what drives up the value of data. And so, which is the antithesis. And so I'm literally just playing this through real time. So I'm wondering if there's something in there to actually point out that, because hoarding data negates its value.
Well, you've seen the ODI's theory of change, right? Where they talk about the hoarding versus the fearing and finding your way to the farmland in the middle.
Yeah. So I see farmland. See?
There you go. Soil.
Came back to where we started.
Well, I guess I'm not entirely certain, but I think we can go. I just wanted the opportunity to say thank you so much. I know that you all have very busy schedules, so it's been wonderful to participate in this discussion.
Thank you for the invitation.
Thank you. Bye-bye.
Enjoy your conference, Brigitte.
We'll go back now.
Whatever.
Bye.